Hello, everyone. Good to see you again. I'm Cheney, Senior Editor for Special Coverage at Devex. And I'm really thrilled to be moderating this conversation on breast cancer care. So, breast cancer, as you may or may not know, is the most commonly diagnosed cancer worldwide. And with early diagnosis and treatment, there is every reason for women to live long and healthy lives. But too often, as with so many forms of cancer, where a woman lives determines whether she gets that chance. In high-income countries, more than 9 out of 10 women will survive at least 5 years after diagnosis. In parts of sub-Saharan Africa, that number drops to just 4 in 10. Too many women are diagnosed late, too many face long waits or high costs for care, and too many encounter barriers that have nothing to do with medicine, like provider shortages or stigma. So in other words, the solutions exist, they just can't access them. And in this conversation, we're going to talk about how to fix that. So in 2024, the Pfizer Foundation launched Action and Impact, a cancer care initiative. It's a 3-year, $15 million effort supporting partners like Jhpiego and Partners in Health to work with ministries of health in Rwanda, Ghana, and Tanzania. And to expand on this partnership and discuss what more is needed to transform breast cancer care, I'd like to introduce our 3 panelists. So we have Darren back. He's the Executive Director for Global Health Investments at the Pfizer Foundation. Nadine Karema, she's Executive Director at Partners in Health Rwanda, and Debora Bossemeyer, who is Senior Vice President of Global Programs and Technical Excellence at Jhpiego. So we often hear statistics about global health inequities, and I just mentioned some of them, but we know these challenges are also very personal. So to ground this conversation, and before we continue, we're actually going to begin with the story of Subira Ali Hamza from Matamwe, Tanzania. Her experience reflects the challenges that many women face, including delayed diagnosis, cost, and fragmented care. So let's take a look at her story.
Kwa jina naitwa Subira Ali Hamza, mzaliwa wa Matemwe, nimeolewa, mama watoto wawili. Nilianza kujibaini buje tu kama buje ndani ya hili ziwa langu. Nikaenda hospitali ya Kivunge. Nikaambiwa na usaha katika lile titi langu. Kuendelea na dawa na shindano na kwenda nikachomesha kila siku shilingi 4,400 natumia zile dawa kuchomesha. Kila siku nikienda natumia 4,400. Mbali ya kutumia dawa za hospitali, nikatumia mpaka za kienyeji. Pale kukaa kufika siku ya siku likapita gari la matangazo. Ukatangaziwa kesho kutwa kutakuwa na saratani ya matiti. Hospitali ya Matemwe. Haya, tukakaa siku ya Alhamis, tukaondoka alfajiri, tukaenda ngojea madokta. Kuangojea madokta, tukakaa pale, kuja madokta wale, wakasimama pale, wakatusomesha, wakatupa elimu uzuri tu kutusomesha, lakini roho kila kikana tetemeka, asake lile limenivimba, kila na ile elimu tunosomeshwa, naona ndo uvimbe wa lile dude nilokuwa nalo. Nikapata kipimo, wakalitizama, kulitizama, akasema huu mtihani. Wakalitizama hali alipokwisha, akaambia itabidi hapa ukapate ultrasound, na ilikuwa tena si haba, ilikuwa ninajisikia mpaka homa. Nikaanisha kuwa kizee naumwa hasa. Ila ninapokaa ambia naumwa. Nikapata vipimo, kupata vipimo, sikutolewa hospitali, nikafanywa upasuaji. Nilipokwisha pale kufanywa upasuaji, nikapelekwa udini, nikapata afueni kwa roho yangu. Hata nilipokwisha pale, nikakaa. Ukanishamaliza ule upasuaji, nikaendelea kuambiwa niende hospitali Mnazi Mmoja. Naenda, tunaendelea na nini? Kebo. Sasa hivi wanataka utaratibu wa kutaka kunisafirisha wanipeleke bara, nikapigwe miozi. Afya si haba, alhamdulillah rabbil alamin, namshukuru Mwenyezi Mungu.
So I want to thank the Pfizer Foundation for their support of our event and also for making the choice to lead with someone's personal story, because I think those kinds of stories can get lost when we talk about the statistics. And building on that story, I'd like to start with you, Debora. For many years, Jhpiego has worked to adapt health programming to local realities on the ground. So building on Subira's story, when it comes to breast cancer care, how are you working to ensure that the solutions work for the realities and limitations you might face on the ground?
Thank you, Catherine, and thank you for having us. I think we all wish Subira was here, and I think we have been talking a lot from like high-level things, but really breast cancer is different, right? It's something that really touches the life of women in many ways. So Subira is a woman from Zanzibar, right? She has 2 young children. She's a mother, she's a wife, she's part of a community. And you can see, if you watch, every time you watch this video, you can see different factors that interfere, right, with getting help. And she saw there was something wrong. She felt that. She looked for help, but she was misdiagnosed, right? And she was also treated with antibiotics, but she had the cancer. Fortunately, at that point, after some time, I think in partnership with Pfizer and the government of Tanzania, especially Zanzibar and the mainland, working with local communities and local government and with the local co-design, she saw some of the awareness in the community, and she saw, I can go there, maybe something that's happening to me. And she went and she saw that, and then she was fast-tracked, right, to her diagnostic. She went to her surgery, chemo, and then they are already planning for her radiation. But she lost time. She was already diagnosed in stage 3, that we know the success of treatment is not the same. So what I want to bring, what I think we with Pfizer and our partner, Nadine, and our organizations, what we are looking for is really to bring preventive care closer to the community, where people are. Women go to primary health care clinics for immunization of their babies, for their antenatal care, for family planning, for other diseases. So that is where we need to inundate in the community and primary care providers with information awareness so she could have been helped earlier. Right? We also need to fast-track diagnostics, right? So we need to bring that to closer as well, even to a secondary level, a district hospital, right? There is more technology now and innovations that we can have. So if we can decrease the time between that she has symptoms and our providers, well-trained, can do the clinical breast examination and see there is something wrong here. She can fast-track to the diagnostic at district hospital, and then within maximum 60 days, be able to decide it is cancer or not, what stage and what treatment she needs, and then fast-track to treatment as well, to multimodality. They need to be equitable as well. I will stop here.
No, that's great. I really appreciate it. And I appreciate the emphasis on preventative care and not just treatment. So that brings me to Darren. So I mentioned earlier Action and Impact, a cancer care initiative. Can you tell us how this initiative seeks to improve outcomes across that journey that Debora was outlining? And how does it build on your existing global health strategy?
Well, you did a great introduction of the initiative. I don't even need to go there, but...
I'm not the expert. Please do expand.
But let me start with the Pfizer Foundation strategy and really sort of how this aligns with our approach to our investments and global health. So for the Pfizer Foundation, our mission is really centered in the belief that the majority of the times, the best solutions to health are by people who are closest to the challenge. Yeah. We know that, we see that in all of our work. And so with that in mind, with that belief in mind, much of our work is really focused on supporting locally led innovation because that's key. So that's sort of the first key strategic pillar for us. And then secondly, we recognize that the Pfizer Foundation and our investments are important. They're catalytic, they build to better health, but we can't do that alone. We have to do that in partnership, and so that's our second really priority area, is that we make sure we work with local leaders, with NGOs, with governments at the local, the national, the international level, all on the same mission to advance access to quality care. And so everything I've just described, I mean, Action to Impact, really it exemplifies all of that. And so we're working with, across the health sector, with partners to test, scale, adapt different models of care, and that's been successful. And then most importantly, our incredible partners here on stage, Jhpiego, partners in health and their teams locally, they're driving that local innovation. And I had the honor of meeting Subira early this year when I was in Tanzania, and really that's what it's for, is to think about the journey that she's been on and where she's at now. And through the work of Jhpiego, she's now got access to better care and better health outcomes.
So Darren, you mentioned locally led innovation, and I want to go to Nadine now because, of course, Partners in Health has worked closely with Rwanda's Ministry of Health for many years. And I want to understand what you're learning from that collaboration when it comes to taking global cancer care frameworks and applying it on the local level. And again, part of what I love about the framing of this session is I think the lessons are cross-cutting, whether people are working on breast cancer or any area of the many areas where there are global health inequities. But what has your partnership with the Rwandan Ministry of Health taught you about ways to adapt these global frameworks to local contexts?
Thank you, Catherine. And it's great to be on a panel with like-minded partners here who believe in health equity. So in Rwanda, what we've been doing is first, based on our ethos as Partners in Health, founded in 1987 by Paul Farmer, is to bring preferential health care to the poor or to vulnerable populations. So we work close to the communities. Just like Debora was saying, it's very important to work closer to the patient, especially the ones who need most of the care. And through our work, we also have different levels of partnership with the Ministry of Health at the national level, in planning, at the decentralized level, where we work mostly in rural communities to understand what are the needs of the local communities that are vulnerable compared to the people in the city, for example. And by listening to the needs on the ground, we have built this long-lasting relationship with the Ministry of Health, and it also comes to a bi-directional partnership, not thinking that we're the one with all the solutions, but we're here to listen. We bring some solutions, but based on what the needs are, and by listening to what the priorities are for the Ministry of Health. And we bring that also with our 5 S's approach, which is making sure that there's enough space. Are there dignified buildings for the care to happen? Systems in place, supplies. Do we have enough diagnostic tools? Do we have enough medications? Social support. Some people, some patients, the likes of Subira in Tanzania, might not be able to come to seek care because it's too far and they don't have the bus fares. So we assess all the needs that the patient has. And we also emphasize on the staffing of health facilities. Do we have enough doctors? Do we have enough nurses? And at the local level, do we work well with the community health workers who are the frontline workers so that patients don't have to walk the long distance or take a long distance bus to come and seek care, but instead there's a community health worker who can teach them how to check if they have a lump or advise them and refer them so that they arrive early enough and they don't end up in those statistics of the 3 out of 4 women in Africa who come and seek care for breast cancer when they're at stage 3 or 4, and rather they survive and thrive because breast cancer is curable.
I love the 5 S's, which I wrote down and want to return to. I think that's very practical, and your point about bi-directional partnership. So I want to ask Darren another question, because this is a moment when a lot of people are looking to philanthropy. For obvious reasons that we've been discussing here in our news programming and across our partner sessions as well. So what does your cancer care initiative reflect about the evolving way that philanthropy is engaging in these issues, not just when it comes to breast cancer care, but strengthening health systems in low and middle income countries?
Yeah, absolutely. But first, we've been very humble. Just having been to Rwanda many times and just seeing the relationship that you have with the ministry, it's just, Partners in Health is incredible. And I think the important word that you mentioned there was listening. And you really are such an incredible partner to the ministry, but you also meet the ministry where they're at. And so congratulations. And it's the same for Jhpiego too.
And I will note, in terms of transferable lessons, I would think that part of the Pfizer Foundation's approach has been You know, yes, it's important for you to build relationships with governments, but a great start is to work with organizations that have existing relationships with governments, as they do. Yeah.
But sorry, Catherine, to your question.
No, that's a great. I'm glad you made that point.
So yeah, with all the headwinds and the changes that we're seeing at the moment in the global health space, philanthropy plays a really important role and will continue to play, I think, an oversized role right now, particularly in fostering innovation. And I think it's most powerful in fostering innovation when that can actually build to sustainability. And again, that's sort of one of the things that we focus on at the Pfizer Foundation, is making sure that we have that pathway to scale, sustainability, and it's all very much rooted in lived experience of the patients, the community healthcare workers, the doctors, government, local leaders. So that's really important. And then really how it builds out healthcare and change, again, it's down to the incredible partnerships and the work of our partners that are really on the ground. They are building these solutions, they're testing new models, they're scaling them. But then most importantly, as you said, and this is the key thing, is that innovation, yes, it's very context specific, but it's important because it can be scaled. And so not only are Partners in Health and Jhpiego looking at the key learnings that they have from the programs and how they can scale those at a national level, it's also about how do you share that on the global stage, because there are other countries that are facing similar challenges and they can take a lot of learnings from those challenges, not just for breast cancer, as you say, but across the health continuum.
Totally agree that innovations have to be context specific, and yet there are learnings that can be applied place to place. So on that note, I mentioned earlier that there are barriers to breast cancer care that often have nothing to do with medicine, issues like stigma, for example. And I do want to make sure we fit into this session any learnings you're seeing, again, learnings that could be applied across contexts when it comes to creative solutions to deal with some of these barriers. You want to jump in, Debora?
Yeah, thank you. So I would say that from our teams in Tanzania and in Ghana, what we are hearing and seeing is when not only the women and the family learn more about breast cancer, first, that it's curable, right, if diagnosed on time. Second, that they are not responsible for that, right? It's not their fault that they had breast cancer. So I think there are like all the literacy, and it's not only for the family, for the community, for the neighbors, it's also for the healthcare providers, for the communities that they talk to, the community healthcare workers, the care groups that they are creating to talk about that. What does that mean for me as a woman to have breast cancer? In many cultures, it's difficult because people know I might pass for my next generation, or I'll have infertility problems after my chemotherapy. So what will happen? I will not be more, desirable. So there are many things, but now things that people start to talk about that. And I think that's one way that we can fight the stigma. But I would say as well, one thing that we are seeing is with the technology, with local capacity, and redesigning services to be more client-centered and not provider-centered. I'm a nurse by training, and sometimes we do things convenient for us, but it's not necessarily convenient for the client, right? Even in the US or in Brazil, if you have breast cancer, you need to navigate a very complex ecosystem, right? So I think simplifying breast cancer care is key, and also women's cancer care. Let's put together them.
Yes, absolutely, and thank you for broadening the lens there. We're nearly out of time, so I just want to come back to each of you very, very quickly. The hope is, of course, that people in this room are feeling motivated to do something about this problem. We talked about this, the most commonly diagnosed cancer, and we talked about the inequity that exists in terms of next steps. If you have one piece of advice for other funders or organizations looking to drive impact in the space, what would it be? Very quickly from each of you. Maybe we'll start with Darren.
Yeah. Okay, so I'll come from the funder perspective. I'm actually going to say two, and I'll be quick. The first would be around meaningful collaboration. And what I mean by that is less talk, more action. And then the second, Debora really just focused on that, is everything has to be designed and built around the patient to meet the patient where they're at.
Nadine, anything to add?
I would say +1 to Darren, and let's not be paralyzed by the fact that cancer care is complex, but rather let's build a coalition with people who think the same, in terms of health equity, and let's work together on making that possible. We know it works. We've seen it working through the collaboration with Pfizer. We've screened at least 64,000 women, and we detected 1,106 women who we know will survive. And let's also demystify cancer to avoid that stigma, right, and make sure that women don't think that it's a death sentence. And we've seen that working in Rwanda because we have peer support groups from women who have survived and come and explain to the other women that it's just part of the journey, but they will make it, and it's just a disease like any other.
And Debora, very quickly, we'll close with you.
Align with national priorities and don't create parallel systems.
And that is definitely a cross-cutting lesson, so we'll close with that. Please join me in thanking our panelists.
Thank you.